Hello and welcome to our webinar with Professor Sally Wyke. Sally is a renowned social scientist who applies social scientific theory and methods to complex interventions to improve health and well-being. Here at the University of Glasgow, Sally is Deputy Director at the Institute of Health and Wellbeing and an interdisciplinary research professor, as well as being Dean of Research for the College of Social Sciences. Sally has a wealth of experience in obtaining grant funding, having been the holder of 62 research grants and has served on a number of grant awarding bodies. I'm wondering, Sally, to kick it off, can you tell us what your parents would describe what you do for a living?
That's a difficult question, Morvin, isn't it? Given how varied our backgrounds are. I think my parents would say, well, Sally's a professor at the University of Glasgow. They were very proud when I became a professor, and really enjoyed my inaugural lecture a good few years ago now. So that was a great day. I think they know that I'm a public health researcher and that I use research to improve public health. And of course, they know that universities have students and that we teach students. So that's the kind of thing. It's funny, Morvin, when you say that we're at the University of Glasgow, I thought I should have put the University of Glasgow background up because, of course, I'm in the Scottish borders and you're in Glasgow. But this event is as a part of our spectrum for the University of Glasgow. So I'm pleased to be a part of it. Thank you.
Well, thank you very much. I suppose one of the reasons that I wanted to get you on our podcast series today is to understand a little bit more about building trusted relationships, and particularly relationships with external partners. And I know that you have a hugely successful programme to do with football and football fans, more specifically. Can you tell me a little bit more about that and how it worked for you both, please?
Yes.
And how did you get started, if you don't mind me asking as well?
Yes. So I co-lead a research program with two other colleagues, one now at the University of Stirling, Professor Kate Hunt, who is a specialist in gender and health, and a colleague here at the University of Glasgow, Professor Cindy Gray, who is Professor of Health and Wellbeing and Health Behaviour Change. So a good few years ago now, perhaps 12, 13 years ago, we were doing research to try to tackle the enormous pandemic of obesity. So a different pandemic and one not infectious in the same way as the one we're currently living through, but still a massive pandemic with big impacts on health and well-being. And here in Scotland in particular, then a higher proportion of men than women are overweight and obese, and yet very few of the programs to help people reduce weight, be it Scottish Slimmers or Weight Watchers, actually are designed with men in mind. That is, they're not designed which in ways that allow men to express and draw on masculinized identities. So we had been doing some research about men and weight management and thought, how do you really reach Scottish men into a weight management program? And all those years ago, we thought, well, the way to do it is through football. That is, could we deliver an evidence-based program in professional football clubs? Well, it was what seemed at the time a great but slightly wacky idea, because how do you begin to develop the relationships with professional football clubs that allows you to develop and deliver weight management programs in those settings? We were fortunate in Scotland at the time, about 2008, 2009, that just at the same time, the Scottish Professional Football League had just set up a charity arm. So for the whole league, there was a charity arm called the Scottish Professional League Trust at the time. It's now the Scottish Professional Football League Trust. So that was our route in. But this is about trusted relationships. And actually the initial route into that charity was pretty difficult. And we used serendipity and our existing network of personal relationships and social skills, I have to say. So my colleague Cindy Gray, her husband at the time was a BBC sports reporter. And he knew just about everybody in the Scottish sports world, and so was able to introduce us to people at the SPFL, the Scottish Professional Football League, and that was a really important routine. So we used our social networks, but then we used the social skills that we got to explain the kind of program that we wanted to do and describe that it was going to be a long haul to develop an evidence-based program and to see whether it would work. I can say more. It took a long time to develop that trusted relationship. It took probably about 3 years of constant meetings, of listening, of representing our view, but understanding the other position. I can say more about that in a little while, but it takes a long time, and it takes constant attention to the personal relationships and using all of those transferable skills of communicating, of listening, of understanding in order to do that. Mm-hmm. So the weight management program that we run is called Football Fans in Training. It's a weight management and a healthy lifestyle program for men and now for women, delivered in professional football clubs in Scotland, increasingly in England, and adapted in different ways across the world now. It's been a 15-year research program, and it's now delivered in partnership with the Scottish Professional Football League Trust, the charity arm, and we have a franchise, a single license agreement with that organisation that they will now deliver Football Fans in Training, FIT. They'll deliver the training, and they will quality assure the programs that are delivered, and they will collect data as to whether it continues to be effective. So there's a lot to say, but I'll leave it to you and see what else you want to know about it.
That's really interesting. What do you think was the key? So you said it took maybe 3 years to get that relationship to the point where you could actually kind of go forward and do something. What do you think there was a one moment kind of unlocking, or do you feel like it was a whole series of different moments that kind of led up to a kind of gentle but ultimately fulfilling outcome?
I think it was the latter. So we originally started off with a meeting with the kind of lead of the charity, and he was very interested, but there's always a lot of other vested interests, and there were other programs being delivered in professional football clubs, because a lot of professional football clubs, in fact most in the UK, have charity arms, as it were, community organisations. They deliver programs, but they're not necessarily evidence-based. And our point of principle was that the program that we deliver must be evidence-based. There's got to be a good theoretical base to how we attract men into it. There's got to be a good theoretical base into how it's delivered, how it helps men reduce their weight and stay active and eat healthily. And there's got to be a good evidence base of how they keep that weight off in the long term. So there's all kinds of other programs available which are not evidence-based, which are not well evaluated. So the issue came not in introducing just any old program into Scottish professional football clubs, but in introducing an evidence-based program and doing the randomized controlled trial, the evaluation, in partnership with that organisation to explain the research process takes time, that if the outcomes are not effective, then it's not something that we would want to be promoting in the end. And it was that constant discussion, each meeting building on the other. I do remember one moment that I think was particularly important, was in trying to convince our colleagues to use a randomized controlled trial to understand if the program was effective. And that's when I said, look, if it's effective, then this is something that you can franchise. You can take ownership of it with us at the university. We're not in it to make money, actually, in this particular case. We weren't looking for any profit from this franchise. What we want is to deliver an effective program for public health gain. And there is something in it for that organisation to be the first in the world to deliver an evidence-based program in professional football clubs. And it was recognising that articulating the value of the program to the organisation in that way was helpful. And open-mindedness on all sides.
Yes, I think that's often key. The open-mindedness on all sides, I think, is really important to make sure that everybody gains something out of it, because everybody wants to do the best they can. So hopefully, okay, that's really interesting. What do you think, if you were in my position right now, what do you think I should ask you that I don't know enough about the program or about you specifically to ask?
Well, it really depends on the focus. I can say a little bit more about the actual program. What I would say about the program itself and professional football club is, whatever the kind of program in any setting, there's two aspects to public health programs. One is, do they reach the people that they're supposed to reach? And the second is the program effective? And what we needed to work with the Scottish Professional Football League Trust on is how to use the power of football to reach people. And then the program itself is effective in that setting for a number of reasons. The setting is important for the delivery of the program, but equally, once you've got people there, then the program could be delivered elsewhere as well. So men enjoy being in the professional football club. They get an insider view. They feel special. They're with people like them who love football. There's a lot of banter. And the program is effective at helping people increase their physical activity and eating more healthily. That's why it's effective. And these habits become long-term that they pick up in a 12-week program. So that's an important thing to know about, which is reach and effectiveness. The other thing about developing relationships is well, probably what I've said already, just to be open and to keep listening. Subsequently, we developed relationships with a range of other NGOs or third sector organizations. And it's about just asking questions, listening to them, understanding the role of that organization in the overall ecosystem of whatever you're in, of whatever it is you're trying to work out, and just keep asking questions. So I think I've probably said that already, but those are the most important things that I would want anybody to know.
Okay. And I suppose if we're thinking a bit more about your role as Dean of Research, in creating relationships more generally, as you see from your position, what do you think the most common reason for academics or partners to give up and to walk away? Do you feel it's the not listening part, or are there other factors that you think are more important and that people should be aware of, so that when it gets hard, you know that you're not alone?
Yeah. So as Dean of Research, one of the main things that I espouse is starting to make the relationships early. And asking the question of oneself. Once in a university, as we are, then we have our own disciplinary foci, we've got our own interests, we teach our students these kind of things. But knowing that the audience is often quite narrow for our particular specialism is quite important. And thinking about who else cares about our research, who else wants to know the answers to our questions, and why might they consider our research and our answers to the questions to be important. That's a mindset to start out with this very early in one's career. Who else wants to know the answers to this research that you're doing, and then going out and finding people who work in different organizations, in civic or society or in the private sector, who who want to know the answers to your research as much as you do. The reason I think that some relationships don't work is that timescales are very different in different organizations. So in public health, there are public health programs, and evaluations might be commissioned. The evaluation is often short term. They want an answer right there and then, whereas the really evidence-based development of a program and a long-term gold standard evaluation will take longer. But the world of civic society and of the private sector operate on much shorter timescales, and possibly with a lower standard of evidence as to what. Although I don't want to say that wholeheartedly, it really depends on the sector that you're working on. So actually, talking about the timescales is really important, and recognizing that actually sometimes our timescales don't match. Where the relationship breaks down is where the people from the university don't understand the needs of our colleagues in other sectors, don't understand their world, and can become a little arrogant actually about that. People have many, many different skills. They're just as clever, they're just as insightful, but using a different kind of evidence base, our partners in other sectors. So I think that's when relationships break down, when we don't listen and we don't try to understand what's in it for them of working with us. Not to overpromise as well. There's so much of a tendency to overpromise from universities. So I think being realistic about what's in it for everybody, what the timescale is, and genuinely what we can achieve. It's a fantastic experience, but it really does need working on.
Yes, I think relationships require constant work in lots of different arenas. So
yeah, that's right.
That's certainly very, very important. And I suppose this is a slightly different question, but if I could remove all barriers, I'm going to wave my magic wand, pretend that COVID-19 doesn't exist, and lots of other barriers don't exist or constraints exist either. What project would you do, and would you want to be known by that project alone?
There's so much. I have a 35-year career history in academic sector and public health research. I'm actually on the board of an organisation in Scotland called Cycling Scotland, which promotes cycling across Scotland with a particular emphasis on addressing inequalities in active travel, but in physical activity, but in particular in access to cycling. That matters to me. I'm on the board, so it's not a part of my academic activity, but I like to think I could use my skills to support increasing cycling for public health, for climate, to reduce carbon emissions. And I'd like to think that people living in very deprived areas can have equal access to cycling. So the research and development project that I'd like to do is a participative one with endless money available to us, with local organizations and people living in housing associations, in public sector or private sector rented accommodation, who have poor access to green space, to good cycle lanes, to safe cycling, to skills and to confidence to cycle. And I would develop a whole programme of research and development to increase cycling across Scotland and indeed across the UK. You know, since COVID has happened and also we're coming into spring, then cycling rates have really increased in Scotland in all areas, but particularly in cities. And there's something that we can tell about the government-sanctioned advice to take at least an hour's physical activity, exercise a day, and the emptiness of the streets that mean people can really feel the joy of cycling. and of getting outside and of being physically active, and how that improves one's well-being. So that's the research I'd like to do, is to have access to the joys of cycling for public health gain and to reduce carbon emissions, but with particular emphasis in a participative approach with people living in very deprived areas.
That's fascinating. My family are big cyclists, I have to say. It is not a sport that I feel particularly strongly about, but I know that they experience great pleasure in being able to escape from the world for a little while, which I think is.
And it's not even a sport, you know. Of course, it can be a sport, but it's a means of transportation. So I hate sport. I never do anything sporty. I never enter a competitive race. I'm just not that kind of cyclist. Many people aren't. But even just using it for getting to work, even just going to the shops with some panniers or your backpack, it's a good way. It's a good way to live. So
that seems like almost a great place to end on. I'm going to ask one final question because I have you captive. What do you wish the world at large knew about social science that you don't think is through to them?
It's a good question. I think that it's not common sense, I think, is the my partner is a physicist, actually, and I have lived with him for over 30 years, and I find it very hard to explain what he does, because I just don't have that skill set. But he feels, and my other family members feel, that they can explain what I do, because social scientists study the everyday life and the structures and institutions which shape how we operate in everyday life. And everybody's got an opinion on that. And yet the training that social scientists do in understanding theories about what shapes our behaviors and our practices can bring real insight and bring real solutions to improve the way that we live. So that's it's not common sense. It takes study, that we've got a real range of methodological skills to use and to apply, and that actually social science-led innovation can be really powerful in all sectors. So I think that's what I'd like the world at large to understand. But then, of course, it's our responsibility to get out there and spread that message, not just by telling, but also by doing.
Well, that seems like an absolutely perfect place to end our webinar. Thank you so much, Sally, for a fascinating conversation. If anyone has any questions for Sally, or if you have any questions in relation to building relationships between academia and industry or any other type of organisation, please do get in touch.
Yeah, thank you, and thanks very much, Morgan.
No, you're most welcome.